Masturbation after 60. How much is too much? A doctor's honest answer. Hello, my friends. I'm a physician who specializes in elder health. And today I want to talk about something deeply personal, often avoided, but extremely important for senior wellness. Mr. Robert is 66 years old. On the surface, he looks perfectly healthy. He walks every day, eats reasonably well, doesn't drink alcohol, doesn't smoke, but one morning, he wakes up with a sharp pain in his lower abdomen. Urination becomes difficult, weak flow, incomplete emptying. He thinks it's just an upset stomach or something he ate, so he drinks warm water and waits. But by the third day, the pain worsens and spreads to his lower back. Every trip to the bathroom becomes a struggle. That's when he finally decides to see a doctor. After an ultrasound and some lab tests, the diagnosis is clear: prostatitis, inflammation of the prostate. A very common condition in aging men. When asked about his lifestyle, Mr. Robert hesitated. Then he admitted, since living alone for several years, he's been masturbating regularly, 3 to 4 times a week. He had no idea this habit could be connected to his symptoms. Does this story sound familiar? Maybe someone you know, or even yourself. Many older adults live alone, and in the absence of intimacy, masturbation becomes a private form of release. There's nothing wrong with that in itself. But when it's done too often or in the wrong way, it can silently damage the body, especially the prostate. There are things people don't talk about because they feel embarrassed. But silence doesn't mean safety. Many don't discover they have a problem until it's too late, when the prostate is swollen, pressing against the bladder, causing urinary issues, back pain, insomnia, or even affecting kidney function. I'm not here to judge or shame. I just want you to understand your body better, to know what's appropriate for your age and condition. If you find this topic important, please take a moment to subscribe to this channel. It encourages me to continue sharing valuable knowledge for senior health. And please, don't hesitate to like and share this video with someone who might need it. A small action today might protect someone's health tomorrow. Next, I'll explain why frequent masturbation can lead to prostate inflammation, how it works inside your body, and what signs you need to watch out for. Let's start with a simple explanation. The prostate is a small gland about the size of a walnut. It sits just below the bladder and surrounds part of the urethra, the tube that carries urine out of the body. Its job is to produce a fluid that nourishes and protects sperm. When you're young, the prostate is flexible and bounces back quickly. But after the age of 50, and especially after 60, it begins to enlarge naturally and becomes more sensitive. If it's stimulated too frequently, like through high-frequency masturbation, it doesn't get enough time to rest and recover. This leads to swelling, congestion, and eventually inflammation. Imagine this. You're using a 20-year-old car to drive uphill every day without brakes, oil changes, or rest. Eventually, the engine overheats and breaks down. The same happens to your prostate. If you don't allow it time to cool down and heal, it starts showing signs of damage. Some of the most common symptoms I see in the clinic include burning or painful urination, frequent urination at night, weak urine stream or incomplete emptying, chronic pelvic pain or discomfort in the lower abdomen, fatigue, low mood, and disrupted sleep. Most people think it's just aging, but often, it's the prostate sending a warning. According to research by the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, over 30% of men over 60 have experienced prostatitis at least once. A large portion of these cases are linked to lifestyle factors, like excessive or aggressive masturbation, lack of hygiene, or doing it in stressful, unhygienic environments. In fact, I've treated patients who use soap, lotions, or random oils as lubricants. These can cause irritation and infections. Some even masturbate while stressed, anxious, or just to fall asleep, completely ignoring whether their body is ready for stimulation. They treat it like a habit, not realizing it's pushing their prostate beyond its limit. And there's more. An inflamed prostate doesn't just affect urination. It can spread infection upwards, reaching the bladder, ureters, and even the kidneys. In seniors, where immune systems are already weakened, this can lead to serious complications, fever, confusion, even hospitalization. One of my patients came in with what looked like a basic urinary tract infection. He'd had mild discomfort for months, but ignored it. When we examined him, His prostate was so swollen it was blocking urine flow, causing his bladder to retain waste and pushing pressure back up into his kidneys. He was in the early stages of acute kidney distress, just because of an untreated prostate inflammation. Here's what makes this tricky. The prostate doesn't always scream for help. It suffers quietly, until one day the damage is too much. That's why people delay seeking help, thinking it's just part of getting old. Let me be clear, masturbation is not inherently bad. When done occasionally, in a healthy and clean environment, it can actually help release stress and support sleep. But when you ignore your body's signals, when it becomes excessive, rushed, or secretive, that's when it turns dangerous. There's a concept I want you to remember: recovery threshold. Every organ in your body, especially as you age, needs time to recover between use. When you exceed that threshold over and over, inflammation sets in. And with the prostate, inflammation isn't just uncomfortable, it can be life-disrupting. So how often is too often? It depends on your health. But in general, for men over 60, I recommend no more than twice per week. And only when you feel physically and mentally balanced. If you feel fatigued, have trouble sleeping, or feel discomfort afterward, stop immediately and reassess. If those symptoms persist, see a urologist. Don't be embarrassed. Don't wait. Your body is speaking. Your job is to listen. Now, I want to tell you about one patient in particular. His story stayed with me because it shows how even something private, something we're taught not to talk about, can become a serious health threat if ignored. About a year ago, I treated a patient named Mr. Walter, 68 years old. He lived alone in a quiet suburban neighborhood just outside of town. His wife had passed away 7 years earlier, and his only son lived on the other side of the country. Mr. Walter was independent. He cooked, cleaned, and took care of his own needs. To anyone looking from the outside, he was doing just fine. He came to the clinic complaining of lower abdominal pain, fatigue, and difficulty urinating. At first, he didn't say much. He just mumbled that it might be indigestion or something he ate. But when I asked him more specific questions, he fell silent. Then he said, very softly, "Doctor, I masturbate regularly." His voice was low. His eyes looked away. I gently reassured him that it was okay to speak freely, that I wasn't here to judge, only to help. We ran a full set of tests, including imaging and lab work. The results came back showing that his prostate was significantly enlarged. Its surface was irregular, and there were early signs of inflammation. His bladder wasn't emptying properly, and there was evidence of urinary retention. He finally opened up to me. Since his wife passed, Mr. Walter had often felt lonely. He admitted that masturbation had become his routine, a kind of coping mechanism. At first, once a week, then 2 or 3 times. Eventually, it became almost daily. It helps me fall asleep, he said, but lately I feel sore afterwards. Tired. I thought it was just old age. He wasn't wrong, aging plays a role. But the bigger issue was his body's need for rest. He hadn't realized that he was placing his prostate under constant pressure. What seemed like a harmless habit had become a hidden burden. What struck me most about Mr. Walter's case wasn't the medical condition, it was the silence. For years, he hadn't told anyone. He never asked a doctor. He thought this was his private matter, something not to be discussed. So he suffered quietly, hoping the discomfort would go away on its own. And Mr. Walter is not alone. There are so many older adults just like him, living alone, carrying questions they're too embarrassed to ask, repeating habits that feel harmless but are slowly damaging their health. They wait until the pain gets worse, until the nights become unbearable, until they finally see a doctor, and by then, the damage is harder to reverse. Fortunately, Mr. Walter responded well to treatment. We reduced the inflammation, adjusted his lifestyle, and helped him set a healthier rhythm for his body. He told me during a follow-up visit, "I wish I had known this 5 years ago. I thought I was just helping myself sleep. I didn't know I was hurting myself." His words are the reason I'm making this video. Because his story isn't rare. Because every day, there are thousands of men suffering from symptoms they think are just part of aging, when in fact, they're warning signs. If you've ever felt like Mr. Walter, tired, sore, unsure if what you're doing is helping or hurting, you're not alone. And you don't have to suffer in silence. There is help. There are ways to live healthily and feel relief, without harming your body in the process. In the next section, I'll give you 5 clear, practical tips to protect your prostate and still maintain emotional balance. These are easy to follow, natural, and backed by medical insight. Let me begin by saying, you do not have to give up intimacy, self-touch, or comfort as you age. What matters most is how you do it, how often, and how well you listen to your body afterward. Here are 5 practical tips I give to my own patients. 1. Limit the frequency, no more than 2 times per week. For most men over 60, the prostate simply doesn't recover as quickly as it did in their 30s or 40s. That's why I recommend a general limit of once or twice per week, especially if you've already experienced any discomfort, fatigue, or urinary symptoms. If you're living with other health conditions like diabetes, hypertension, or kidney issues, then even less may be appropriate. Pay attention to how your body responds. If you feel drained, sore, or have trouble sleeping afterward, that's your body saying it needs rest, not stimulation. 2. Always maintain cleanliness and hygiene. Wash your hands thoroughly before and after. Keep your private areas clean and dry. Use a clean towel. If possible, take a quick shower afterward. Infections often enter through tiny skin irritations or from poor hygiene during private moments. Please, never use public restrooms or unsanitary spaces for this kind of activity. That increases the risk of infection significantly. Many cases of bacterial prostatitis begin this way. 3. Use natural lubrication if needed, never harsh products. As we age, our skin becomes drier and more sensitive. If needed, use a simple, fragrance-free, water-based lubricant. One natural option is virgin coconut oil, which is gentle and antimicrobial. Do not use soaps, body lotions, or scented oils. These can irritate the skin, inflame the urethra, and disrupt your body's natural protective layers. 4. Avoid late-night stimulation. It disrupts sleep. Many older men masturbate late at night hoping it will help them fall asleep. In reality, the opposite often happens. Sexual stimulation activates the nervous system. It can spike your heart rate, disturb melatonin production, and lead to insomnia over time. If you choose to do it, pick a time when your body is well rested and your emotions are balanced, never out of boredom, loneliness, or stress. Let it be an act of self-respect, not self-escape. 5. Support your prostate with nutrition and light exercise. Certain foods are wonderful for prostate health. I recommend incorporating the following: cooked tomatoes, rich in lycopene; pumpkin seeds, high in zinc; fatty fish like salmon, rich in omega-3; olive oil and walnuts; soy products in moderation. At the same time, cut down on processed meat, fried foods, caffeine, and alcohol. Drink plenty of water, especially during the day, not before bedtime. To avoid nighttime urination, light daily movement is also important. A 20 to 30-minute walk, gentle yoga, or deep breathing exercise can improve circulation to the pelvic area and reduce inflammation. Even 5 minutes of stretching every morning can make a difference. And here's a folk remedy I recommend to many older men. Chew a handful of pumpkin seeds daily, raw or lightly toasted. No salt. They're rich in zinc and plant sterols that naturally support the prostate. If possible, get a prostate exam once a year, especially if you've had symptoms. A PSA blood test or simple ultrasound can catch early issues before they become serious. Prevention is always easier and cheaper than treatment. Let me say this again. Masturbation is not wrong, but ignoring your body's needs and limits is. With a few small adjustments, you can enjoy comfort without consequence. In the final section, I want to say a few heartfelt words, a reminder that you're not alone, and your health is always worth protecting. Dear friends, there are things in life that seem small, private, even invisible to others, but if left unchecked, they can shape our health and happiness in powerful ways. Masturbation, when done responsibly, can be a healthy part of life at any age, but done too frequently, without rest, without mindfulness, especially after 60, it can silently damage your prostate, your sleep, your energy, and your peace of mind. I didn't make this video to scare or shame anyone. I made it because I've seen too many older men suffer in silence. Men who were too embarrassed to ask questions, too proud to admit discomfort, too late in seeking help. If you've watched this far, I know one thing for sure: you care about your health. And that matters A lot. So I'm inviting you to take a small but powerful step today. In the comments, leave a commitment, not for me, but for yourself. Just write, I will listen to my body. I will know when to stop. That one sentence could be the beginning of real change, not just for you, but for others who see it. Your comment might encourage someone else to reflect, speak up, or ask for help, and that might make all the difference in the world. If this video resonated with you, please hit the like button so we know this message matters. Subscribe to the channel if you'd like more health guidance like this, delivered with honesty and care. And most importantly, share this video with someone you love, a brother, a friend, a father, because maybe, just maybe, it will help them before it's too late. We can't stop time, but we can live with more wisdom, more gentleness, and more power when we choose to understand our own bodies. I wish you strength, peace, and good health always. And I'll see you in the next video with more stories, more science, and more ways to stay strong through every season of life.